I want to just come back to our colleagues in America for a moment, because you are acting as our front runners and our pioneers. We've heard about the political commitment, we've heard about the success, and what I wanted to see is what else we could ask from you. So let me ask Paul. The American Association of Kidney Patients has been a key player in bringing the momentum around kidney disease in Europe. Can you give us some insight about the advocacy process? Because we have here patients, we have clinicians, and everyone's aligned on exactly the same demands. So how do we take inspiration from your advocacy?
So how are we effective? It's actually very easy. We take lessons from our history. So in our history, we're used to working with our elected leaders across the United States. We're used to working with presidents. I myself have served 4 presidents of the United States and 3 state governors. We've assembled a board of directors that has tremendous background on Capitol Hill and in political campaigns. And what we did is we decided not to wait for government. Government works for us. It's not the other way around. So we use the best technologies possible to organize and develop the technologies for AAKP that can hold elected leaders accountable, that can impact research through superior survey mechanisms, and also that can help our allies in the private sector provide the research and the data they need on patient insights to be effective in creating human-centered design to advance innovation. But I will tell you this, as you listen around the table there, the most powerful voice, we believe, is the voice of the patient consumer. And the organized voice of the patient consumer in the United States is quite powerful. It's why we've actually created the only kidney patient voter registration program in the United States, and partly in response to a sad meeting at the United Nations several years ago, where the solution to the future of kidney care seemed to be to give less care. We decided to go ahead and organize in 2019 the Decade of the Kidney and a global innovations summit run by kidney patients that last year, in partnership with the George Washington University here in Washington, D.C., attracted patients and researchers and elected leaders in 80 countries and over 20,000 viewers. So what I can tell you is that our success has been able to be realized by using technologies like social media, high impact media, to work with elected leaders to formulate the agenda, the budget priorities, to impact the research, and to give voice to patients at the table at an equal level to a doctor and at an equal level to a government representative, so that our voice is part of the equation. And I can tell you that the demand globally in countries that do not have infrastructure for water or for energy, the demand to live by kidney patients is universal. And the aspiration to continue with your life despite a chronic disease is universal. And if we can organize that, which we are doing, and bring that voice to elected leaders will be even more effective, we think, in advancing these ideas of innovation and artificial kidneys and those things that are ecologically sound and conserve resources. But at the end of the day, it has been high value information, good intelligence on the political process, skilled practitioners, good technology, and great allies like you have there, Hilde Waltman, and also the good doctor who invited us to be there. Because when you take a look at what it's needed to reach consensus, you need folks like Dr. Van Holder and others who will lean forward and bring patients into the equation. And as patients, we have a responsibility to bring our voice in an organized and respectful manner, but very forcefully to the table.
Thank you, Paul.